So today's talk is about clinical integration. Clinical integration is one of the most important types of integration. It's one of the types of integration that is most susceptible to bring about cost reductions and quality of care in the Canadian healthcare system. And it's the type of integration that is the most useful for dealing with complex conditions. So let's start by looking at a definition of clinical integration. Actually, before we get the definition, I'm going to tell you how we'll proceed in this talk. First, I'll talk to you about clinical integration and mostly in the context of a professional organization. And we'll talk about that later, but the healthcare organization is a professional organization. So we'll try to understand what these type of organizations have that makes them particular. We'll also talk about the challenges of implementing change in the professional organization, in the healthcare organization. And after that, we'll talk about the articles that, two articles that are illustrations of clinical integration. So in terms of definition, there is no consensus on what is clinical integration. A lot of authors have taken the liberty to give their own definition, but I've picked two definitions that are found in the literature. And like I said, there's no consensus, but these two definitions are useful to sort of illustrate what clinical integration is about. So the one from Shortell and colleague that I've picked says that it's the extent to which patient care services are coordinated across people, functions, activities, and sites over time so as to maximize the value of services delivered to patients. There's also one from the American Medical Association. It says that it's the means to facilitate the coordination of patient care across conditions, providers, settings, and time in order to achieve care that is safe, timely, effective, efficient, equitable, and patient-focused. So you can see that these definitions have in common this idea of coordination, of continuum, of patient-centered care. And basically, horizontal integration, vertical integration, physician integration, functional integration, all of these different types of integrations can contribute to clinical integration. So, for instance, when we look at horizontal integration, which brings different type of healthcare organizations under the same management umbrella, for instance, like a multi-site hospital, having the hospital manage from the same management entity, for instance, can help to facilitate clinical integration. So we'll talk more about this, but clinical integration, basically, I'm saying the other types of integrations that are discussed in this course all contribute to clinical integration. But really the key to clinical integration is really coordinating people. And for understanding how people are coordinated for clinical integration, we need to understand concepts about professional organizations, because a healthcare organization is a special type of professional organization. And so here, before we go into dissecting what a professional organization is, let's contrast the healthcare organization with other types of organizations like banks, for instance. So here on this slide, I am comparing the hospital and a hospital and a bank on two dimensions that are very important when we talk about health services management: coordination and control. So in the bank, for instance, for coordination, there's a large reliance on the command and control approach. So that means that managers at different levels of the organization use downward communication of explicit knowledge and commands in order to coordinate work. And for controlling quality and effectiveness, they use pre-programmed tasks in management planning processes and so on. All of this is used for ensuring that the products of the work or the services are of good quality. In contrast, in the hospital, which is a professional organization, the coordination of work is largely left to professionals because they're autonomous. So coordination of work relies mostly on professional discretion rather than downward commands of orders coming from the hierarchy. So now, in terms of control, when we talk about control for a hospital, it comes mostly upstream from the training of the healthcare professionals. So the control of quality and effectiveness comes from the training. So it's done upstream. The way that professionals are trained to conduct their work helps the control. Or it can come from the professional associations or peer control. It usually does not come from the top level of the organization. So, for instance, in a hospital, so let me give you the example for the bank. For instance, in the bank, the account managers could be told to work more closely with the financial advisor for purchasing stocks, for instance, for clients, and that order can come from higher up in the hierarchy, right? But in the case of physicians, for instance, the hospital cannot decree that, let's say, all specialists have to follow up with family physicians once they have cared for a patient, right? This order would have to come from the Royal College of Physicians, for instance, and not in the form of an order, but rather in the form of a guideline. Okay, so this shows that the healthcare organizations, the hospitals, for instance, are different from the other types of organizations, such as bank, right? Because the control and the coordination of work is not done in the same way, and so knowing that is important, because in some organizations the command and control approach to directing work can be implemented, but not so much in the healthcare organizations, and therefore clinical integration is often dependent on the goodwill of the professionals, and so that's a very important point that I wanted to make here. Now let's go right into looking at what makes an organization, to talk about the five basic parts of organizations. And I'm taking this work from Henry Mintzberg. He says there are 5 basic parts to an organization. So you have the operating core. That's where the services and the products are produced. That's where the work is done. And you also have the strategic apex. The strategic apex, that's the home of top management. There's also the middle line. The middle line, these are the managers who stand in between the strategic apex and in the operating core. There's also the support staff. The support staff, these are the specialists who provide support to the organization outside of its operating workflow. So these are the people who support the operating core. And lastly, there's a technostructure. The technostructure, this is really people. These are people who sort of design the work processes and do all the planning and things like that.